Our digital story is about digital health on television and its delivery, psychology, and use. New media technologies are increasingly crucial to the expansion of access to information services, and health services are no exception. What is eHealth? What is telemedicine? Are they the same thing, or are they different altogether? According to World Health Organization, eHealth has three aspects. 1. Delivery of information through telecommunications. 2. Use of technology to improve public health services through the training of healthcare workers and professionals. And 3. The use of e-commerce and e-business practices in health systems management. By comparison, the American Telemedicine Association lists telemedicine's four main uses. 1. Referral services. 2. Remote patient monitoring. 3. Consumer medical information. And 4. Medical education. The worldwide telehealth services are expected to grow 10 times larger from 2013 to 2018. This year, many employers will have telemedicine options in their health plans.
Together, eHealth and telemedicine raise 1,000 possibilities and 1,000 more questions. What is cost-effective? What is ethical? Malpractice suits could become a bigger challenge than they already are. Will doctor and patient still receive the same amount of privacy and accountability that is expected both of and for them in a hospital setting? Greater convenience always comes with greater risk. And there is no doubt that telehealth is convenient. Faster access to patients' medical history is provided through electronic record keeping. Scheduling conflicts and medical research are deftly handled through the eHealth system. Consolidated resources are no longer an issue because the necessary equipment and the professional who knows how to use them no longer have to be in the same location. Digital health information was previously available only to healthcare professionals and insurance providers, and now it is readily available to patients. Where new technology is concerned, populations are divided into 5 distinct categories. 1. Innovators. 2. Early adopters. 3. Early majority. 4. Late majority. And 5. Laggards. The first group are the innovators. These are the people who don't just adopt new technologies and ideas, they're the ones who dream them into existence. The second group are the early adopters. These are the hipsters, the "I did that before it was cool" group of people who readily embrace innovation. The third and fourth categories are the early and late majorities. Both of us fit into these groups. We're not the first and we're not the last when it comes to embracing change. The last group are the laggards, those who refuse to take advantage of new technologies and methods, even if they understand the benefits of those technologies. A very important factor in whether or not people are likely to adopt new technologies is whether or not they have already adopted earlier technologies. If an individual isn't the type to go out and purchase a new device as soon as it emerges on the market, then they are not likely to change into someone who does. In his book, Digital Health, Barry Gunter lists the 5 attributes of innovation that can affect the rate at which new technology is adopted. The first attribute is relative advantage. Do the benefits outweigh the costs? The second and third attributes are compatibility and complexity. Will the new technology build upon pre-existing technologies, which are both simple and inexpensive, or will the new technology require additional knowledge and resources? The final 2 attributes are trialability and observability. Will the public be given the opportunity to test the new technology before it is officially released on the market? All 5 attributes, relative advantage, compatibility, complexity, trialability, and observability, must be present in order to influence innovation and adoption of new technology. It is important to note that the intention to adopt doesn't actually mean someone is going to do so. This is what Gunter refers to as inherent innovativeness versus actualized innovativeness. For instance, Wagata and I are excited about Apple's announcement of the iWatch that will be released on April 24th, 2015. For $350, the general public, the wealthy general public that is, can buy a watch that has GPS, receives notifications, provides access to the user's iTunes, and detects pulse and heart rate. Don't have a significant other or a dog to join you for long walks on the beach? You can have Siri accompany you instead. Since we're poor college students and we both have to spend that $350 on textbooks and meal plans, we won't be buying the iWatch anytime soon. So even though we're fans of the product, we are an example of inherent innovators. people who intend to adopt but don't actually end up doing it. People who do go out and buy the iWatch would be considered actualized innovators.
We would also like to point out that social constructs can play a role in influencing someone's use or adoption of technology. Family values, legacy, and sentimentality can affect willingness to adopt new technology. Some people prefer holding onto their vinyl records, 8-tracks, and cassette tapes, even if they know such technology is now considered obsolete. The iWatch is an excellent example of how one communications technology can displace the use of another in that it seeks to replace the iPod, as well as a regular watch. By comparison, the digital television has replaced the analog television, and the internet seems to be slowly replacing television itself, particularly where health information services are concerned. This is to be expected, and in some cases, prepared for. Interactive digital television, otherwise known as iDTV, is any number of efforts to allow viewers to interact with television content as they view it. One of the main purposes of iDTV is to provide members of the public with easy access to a range of health information. Great Britain has embraced the use of iDTV more than almost any other nation in the world. Most households in Great Britain are more than likely to have one TV set in their home. According to statistics, a whopping 98%, hence the popularity of iDTV. And by 2003, roughly 40% of Brits had access to iDTV in their homes. iDTV is very easy to access, even for someone considered to be less technologically advanced. Users are merely required to be registered, and there you have it. With just a click of a button on your remote, it's easy to navigate and view health-related content from the comfort of your couch. In 2003, another technological phenomenon first made its appearance on the market: wireless keyboards. The keyboards released by Apple had Bluetooth capability, with Bluetooth itself having been invented in 1994.
iDTV got its start through PTT teletext via analog television. It was first created in the 1970s by Philips, the Dutch electronics company. The world's first teletext information service was called CFAX, and it was established in the UK in 1974. CFAX, originally titled BeebFax, Beeb being short for BBC, and fax, as in fax machine, enjoyed great popularity in the UK as it provided viewers with subtitles for their favorite shows and flashed breaking news at the bottom of the television screen. It even included scanning capabilities. CFAX also cached users' data, allowing them to revisit their favorite channels whenever they desired. Due to CFAX and iDTV's great popularity with the general public, in 2001, the British government authorized 4 pilot programs for interactive and digital health television. Behind this push was the UK's National Health Services Branch, also known as the NHS. The health programs from the NHS were designed to reach smaller, more rural populations in the British countryside who were of a low socioeconomic class and preferred television to computers, either because they couldn't afford a personal computer or were simply reluctant to learn how to navigate one. The government hoped that these interactive television channels would be a useful substitute for those seeking health information who couldn't manage to leave home or afford to see a doctor. These 4 programs were Channel Health, FlexTech Living Health, Interactive Lifestyle Communicopia Productions, and A Different Kind of TV, also known as DKTV. Each program offered various services, including transaction services, which allowed for two-way communication between clients and nurses via the client's television and phone line combined. Brits could connect to community health support groups, book appointments with their doctors, chat face-to-face with a nurse, receive calendar reminders for their children's vaccinations, read medical encyclopedias, and take health quizzes. Gunter's book stops there, but the technology doesn't. In 2008, a new television service arrived on the market: Internet Protocol Television. Internet Protocol Television, known simply as IPTV, shares the same language as the Internet but does not operate in the same way. Internet Protocol technology allows your television, personal computer, home phone, and wireless devices to link up, allowing the user more personalization and control. IPTV is more advanced than both traditional cable and satellite television because it allows for more flexibility and two-way interactivity among users. It's the technology that allows you to rewind live television, watch shows recorded from your DVR on any television in your house, watch a movie with a friend on the other side of the world at the same time, and it even lets you connect multiple devices to your home network using the Ethernet port on the back of your set-top box. IPTV is also not to be confused with iTV. iTV is provided through internet access, and IPTV is provided through broadcast streaming. iDTV differs from both in that it is provided through digital signal. Although iDTV is the main subject of our study, it's important to note that iDTV has largely been embraced by the British public, not so much the American public. Americans adopted satellite TV, HDTV, iTV, and IPTV more quickly than Brits did, and prefer all of those services to iDTV. This includes the use of those services in regards to health information seeking.
Forward, we still find several challenges within the realm of eHealth and telemedicine, and iDTV is a part of that. Firstly, eHealth and telemedicine may increase healthcare disparities by mainly helping individuals or communities with access to more resources such as televisions, computers, cell phones, and other mobile devices. In fact, those of a higher socioeconomic status are more likely to look up health information and advice services online, even though these new technologies are intended to benefit those within disadvantaged, poorer, or minority groups who cannot physically attend or afford to visit a hospital or clinic. This was especially true in Great Britain. Telecommunication developers have made large strides with regards to creating more powerful, fast, and user-friendly software, while at the same time lowering prices for these products and their services. These measures help towards closing the digital divide among population groups, but despite these efforts, the divide remains. According to researchers from Stanford University's Department of Computer Science, factors influencing the digital divide include education, income, race, and in some cases, location. Those with college degrees are 10 times more likely to have internet access to work than those who have only received a high school diploma. Researchers at Stanford further conclude that the gap will widen even more with time and continued developments in technology. Race can also heavily influence the level of technology within a community. According to a study conducted by the National Telecommunications and Information Administration, also known as the NTIA, racial disparities in internet access exist regardless of income. This study by the NTIA observed Hispanic, African American, and Asian American communities. To the Hispanic community, internet was seen as a luxury, not a seed. Within the African American community, most of the encounters with technology were reported as negative, whereas the Asian American community reported positive, significant use of new technology.
So how can the digital divide ultimately be overcome? Financial support, increased access to technology through community access centers, such as libraries and schools, well-trained technical staff, and a change in public attitude towards technology are all requirements for bridging the gap. Fortunately, several programs dedicated to closing the divide already exist. The U.S. Department of Education and the U.S. Department of Housing and Urban Development provide grants, loans, and volunteer service to economically distressed communities seeking technological advancement. But the government isn't the only entity getting involved in this effort. Private corporations such as Microsoft, Intel, AT&T, and America Online have contributed research and funding. Nonprofit organizations like City Skills give communities career-building opportunities by providing access to tech training, relevant news, classified listings, and community forums with bulletin boards. All three groups, number 1, federal agencies, number 2, major corporations, and number 3, nonprofit organizations, are represented in Power Up, itself a nonprofit organization that serves as a coalition for leaders and policymakers to exchange useful resources and ideas designed to eradicate the digital divide. Although the internet and other television services are considerably more popular than iDTV, especially in America, iDTV has played a crucial part in providing overlooked or disadvantaged publics with the necessary resources to maintain a healthy lifestyle and has played an important role in bridging and eventually closing the digital divide.